This is a very slick airplane. I love flying. We've done it for many years. My son is a flight instructor. He got me my private pilot rating and my instrument rating.
After years of enjoying aviation as a family hobby, Dr. Jeremy Cole was grounded, driven out of the cockpit by debilitating back pain.
I've had chronic bad back problems for at least 15 years. This was becoming an unlivable situation. It was really interfering with my life. Every time we would go on a trip, I would walk and then have to sit down. I mean, I felt like I was 100 years old.
That is, until he met orthopedic spine surgeon Dr. Brett Brawley.
What we know is that people fear spine surgery because once you have a fusion, it's just a matter of time before you start dominoing up your spine, right? That is historically because we've been fusing people flat. What we know now is if you recreate that natural curve in the low back, you can minimize and actually protect the level above.
Dr. Brawley specializes in minimally invasive back surgery and a cutting-edge procedure called XLIF, Extreme Lateral Interbody Fusion.
And I think it's a great tool to have. You know, I think like anything, no two patients are the same. And so the more options that you have to try to tailor a surgery to fit their needs, the better they're going to do in the end.
Dr. Cole was a great candidate.
He had developed some instability in his spine, meaning his vertebral bodies were sliding around on each other. And he had been avoiding seeing a surgeon for some time because his fear was that he needed a traditional open, big spine surgery. What we know now is that if you have that kind of instability, what you really need is just to add some stability, and we can do that in a very minimally invasive way now.
And I'll show you.
Dr. Cole opted for a single-level XLIF to stabilize his spine. Instead of 3 days in the hospital and weeks off work, he was back at home the next day and back to work at his own practice the following week.
I was walking the day after, sir. I was walking when I got out of the recovery room. They started yelling at me, stay in bed, you know, let us help you out. And I said, no, I want to go to the bathroom. I was walking without pain, without that pain, without that pain.
Dr. Cole is now back in the cockpit. His pain is gone.
I'm able to do my practice. I'm able to do my flying. It's like a new life.